Well, my friends, this is the case of a gentleman, age about 57 years. The patient has come from Dinajpur district of Bengal. Dinajpur district of Bengal. He has been suffering from dyspnea, which is called asthma. For last 20 years, 20 বছর ধরে কষ্ট পাচ্ছেন। চিকিৎসা এর আগে কিছু হয়েছে? কোনো চিকিৎসা ঠিকমতো হয়নি। গ্রামের গরিব মানুষ, চিকিৎসা ঠিকমতো হয়নি। এখন এই অ্যাজমাটিক ট্রাবলস যদি বেশি দিন ধরে চলতে থাকে, ক্রনিক হয়ে যায়, তাহলে লাংসের যে অ্যালভিওলাই সেগুলো ডাইরেক্ট করে দেয়। অ্যান্ড দ্য কন্ডিশন ইজ নোন অ্যাজ এমফাইসিমা। তখন ভেরি ডিফিকাল্ট টু কিওর হয়ে যায়। এগুলো তো বোঝেন না আপনারা, ফেলে রাখেন। অ্যান্ড অন টাইম দ্য এমফাইসিমা ডেভেলপস, which is very difficult to cure, and the progress of disease increases. Now the question comes, what is asthma or respiratory distress? Nowadays this has been called the COPD, chronic obstructive pulmonary disease. The old name is asthma. So asthma is the chronic inflammatory disorder of the airways, characterized by chronic airway inflammation and obstruction. Chronic inflammation is associated with airway hyperresponsiveness that leads to recurrent episodes of wheezing, difficult breathing, tightness sensation in the chest, and of course coughing, kashi hoy, and of course coughing. It is due to reversible regioning of the airways, and the restrictions of the airway is not permanent until the emphysema is developed. The episodes are usually aggravated at night and in the early parts of the morning. So this patient also aggravates in the early parts of the morning. সকালের দিকে বাড়ে। 3 factors are responsible for asthma. Number 1, bronchospasm. This spasm due to tightening of the constricting muscles of the smaller bronchi. Number 2, congestion and thickening of the linings of the bronchial tree. And number 3, accumulations of mucus and phlegm in the smaller bronchi. Now the asthma may be of 2 types, bronchial asthma and cardiac asthma. The bronchial asthma is characterized by paroxysm of breathlessness, sensation of tightness of the chest and wheezing respiration, and with viscid bronchial secretions which our patient developed. So characterized by paroxysm of breathlessness. And the cardiac asthma, the name itself indicates it is related to the heart. When mild exertion causes severe breathlessness due to heart failure and due to pulmonary congestion, which is caused due to heart failure. This is due to build-up of fluid in the lungs, which impairs the ability to supply oxygen in the lungs. Now another variety of allergy. In the old practice of medicine, these 2 types of asthma has been mentioned, bronchial asthma and cardiac asthma. Nowadays we have also observed another type of asthma, and we are very much accustomed and habituated to see this asthma, which is known as allergic asthma. Allergic asthma. So allergic asthma is caused due to some allergens. Here the IgE of the serum is increased to encounter the allergens. সৈনিকের কাজ করে প্রতিহত বাইরের জিনিসটাকে প্রতিহত করার জন্য, এই অ্যালার্জেনদেরকে প্রতিহত করার জন্য শরীরের যে জীবনী শক্তি IgE গ্লোবিউলিন বেড়ে যায়। So allergic rhinitis are often present when a person is sensitized from some allergens. Such allergens may be tobacco, household aerosol, paint fumes, pollens of the flowers, house dust, dander of the animals, etc. But be remember, my friends, When the asthma is severely aggravates, the condition is known as status asthmaticus. The patient, you should not keep your hand, it should be transferred immediately to the hospital because it is nothing but the severe and persistent attack of asthma and sometimes continuing for many hours or even some days together. The patient becomes exhausted and demoralized due to lack of sleep and physical effect of breathing. They may be cyanosed with profuse sweating, with a rapid pulse rate and sometimes low blood pressure, which can lead to mental confusion and due to lack of oxygen or even to coma or a fatal outcome. It is better to immediately hospitalize the patient. Be remember, my friends. Now, what will be the selection of this patient? The selection of this patient is very easy to me. This is a psoriatic asthma. There are some asthma are psychotic. Asthma aggravates in the morning, aggravates in the winter. The asthma aggravates at winter, all are psoriatic asthma, and asthmatic troubles aggravates at the monsoon are definitely psychotic asthma. The main two principal medicines of psychotic asthma are natrum salve and thuja. And the main psoriatic asthma are hypersulfur, calcareous carb, sorinum, cardicarb, and other medicines. This patient is suffering from the psoriatic asthma, which aggravates at winter, aggravates in the morning, relieved by bending backward. The patient is chilly and highly irritable. There is history of suppression of skin disease. So, no doubt, our prescription is very easy. Our selection is very easy. The medicine is hypersulfur. So, let's prescribe hypersulfur in 50 millisimal scale of potencies and let's see the result, my friend. With the direction, try it in a day, morning, noon and evening. I do like to prescribe and to advise the patient take in this way. বলুন, সব বুঝতে পেরেছেন যা বললাম? বুঝেছেন কি না?